Hello, this video is taking the scare out of making breast cancer treatment decisions. If you are here because you've been diagnosed with breast cancer or a friend has, you're in the right place. This is scary, I know, but I'm here to help you to take the scare out of making breast cancer treatment decisions. Hello, I'm Marnie Clark, and I'm a breast cancer survivor and a breast cancer coach. I've got some vitally important information packed into this video, so be sure you stay tuned right up to the end. If you are facing breast cancer, over the next weeks and months, you are going to be called upon to make some very important decisions about what you want to do. Here's what some of them might be. Things like whether or not to have a lumpectomy. This is where your surgeon removes only the tumor from the breast, also known as breast conservation surgery. You may need to consider mastectomy, where the entire breast is removed. You may then be offered reconstructive surgery, and there are several different types to consider. You may be offered chemotherapy or radiation, or a combination. You may be told that you have to have hormonal therapy as part of your treatment. You may also be offered a targeted drug like Herceptin if you have a type of breast cancer known as HER2 positive. So you need to prepare yourself for making these treatment decisions ahead of time so that you can make empowered decisions, ones that you'll be happy with over the coming years. Not too much pressure, eh? My first piece of advice would be to take a friend or a partner or even a recording device to each and every one of the medical appointments where you will be required to make a treatment decision. Mostly because two sets of ears are always better than one. At some point, you are going to get overwhelmed with information, and that's when you stop listening. And you don't want to miss any important information, that's for sure. Secondly, and this is important, know that you have time to make your treatment decisions. By the time you have a tumor that is detectable, it's already been growing for 8 to 10 years. So a sudden burst of excessive stress might have led up to it becoming detectable. It might have made it progress a little bit more rapidly than it otherwise might have, but you still have plenty of time to make your treatment decisions. And a recent study confirms that. A study released in February 2020 indicated that we do indeed have plenty of time to make treatment choices after being diagnosed with breast cancer. Researchers found that waiting between 31 to 90 days for that first treatment after diagnosis was beneficial for patients who wanted a more extensive diagnostic plan and additional time to make decisions. When I was diagnosed, I was working as a natural therapist. Everything I believed in was called into question when I was told I was absolutely going to have to undergo chemotherapy and radiation. For me, those were dirty words. I needed time to think about this, to go home and heal up from my surgery and decide whether or not either of those made sense to me. I took 4 months to make my chemotherapy decision. I did choose to have chemotherapy because even my natural therapists were urging me to do so. I chose not to do radiotherapy at all, but I did do loads of other things instead, and you can find out what those things were on my website. The link is below. It was important for me to be able to make my healing choices from a combination of both conventional medicine and natural medicine, and I believe that it made all the difference. I was able to choose each modality that made sense to me at the time, and I combined them to give myself the best chance of beating this. In my years as a breast cancer coach, I have discovered that blending both conventional medicine, and by that I mean the traditional therapies of chemotherapy and/or radiation and/or hormonal therapies, together with natural medicine gives the absolute best results for reducing risk of the cancer returning. I have also found that choosing only natural therapies is often not enough. For a few it is, but not for others. There is no one-size-fits-all answer to treating breast cancer, so it's important to learn about the pros and cons of each of these therapies prior to saying yes to any of them, and I can help you with that. I believe it's important to honor the wellness choices each person makes and to respect their religious and spiritual beliefs even if they are quite different from our own. Many doctors don't take these important differences into consideration. Some act absolutely outrageously if a patient doesn't follow their recommendations to the finest detail. That's not okay, and you have every right to switch doctors if that's happening to you. Sometimes it's appropriate, when you have the time, and you usually do, to not make any more decisions until you have more information, or until you've talked to that friend who has been through it. This is completely okay. You should not feel rushed when making treatment decisions for breast cancer. Sometimes, however, people can feel absolutely frozen in fear and can't make any decisions at all, what the Reverend Dr. Martin Luther King called the paralysis of analysis. Getting past that feeling of immobilization can sometimes be difficult, but I'd encourage you to try. So I've got 4 tips for overcoming decision-making paralysis. Number 1, if a lack of information or understanding about the path you need to take is holding you back, talk to your doctor. Talk to me. Discuss it with that friend who has been through breast cancer. Do a search on the internet, but don't dwell too long there because the misinformation out there is alarming. Spending loads of time on the computer also steals your precious energy, time you could use for healing. Instead, get a friend or family member to search for you. But don't let lack of information hold you back. We live in the age of technology when information is in superabundance. Number 2, if fear is holding you back, talk to a therapist or a counselor. Discussing your breast cancer diagnosis with a trained professional can often be extraordinarily helpful. I find that fear usually stems from anxiety, which is completely natural given what you're going through. Get a handle on that fear and anxiety, though. It can impede the healing process. If fear and anxiety continue, if you don't know how to meditate, then please learn. There is nothing more calming, more grounding, and more helpful than meditation or prayer to calm fear and anxiety. Meditation and prayer can help you focus on the problem at hand, help connect you to your intuition, and help you make a good decision for the right reasons. And being calm and centered helps with that process. Seek solitude. A long walk in nature usually helps because you are alone with your maker and your thoughts. This can really help to clear your mind and put things in perspective. You'll find the decision-making process comes a little easier once you've done this. Psychology Today offers us this tasty bit of advice. You can practice confident decision-making by remembering a simple dictum over and over. You cannot have certainty, and you don't need it. By accepting that no certainty exists and that you don't need it, you'll instead harness intuition and, by extension, confidence. If I can help you on your breast cancer journey, I'm honored to walk alongside you and help you. I have many years of experience with breast cancer. I lost my mother and my grandmother to this disease, and then I went through it myself in 2004. So I've made it my business to understand this adversary, to know what works and what doesn't. And I've worked with hundreds of coaching clients since 2012. It's all about helping you through breast cancer so that you are healthy and thriving on the other side of this. Thanks for watching.